but my allergies wouldn't let me put your top down.
The power of Allegra. It relieves your toughest symptoms on the toughest pollen days. Only Allegra is both fast and non-drowsy.
Goodbye, symptoms. Hello, Dream Machine.
Allegra. Stop suffering. Start living.
CBS News. Original reporting.
This week is National Infertility Awareness Week. It's a movement that wants to inform the public about infertility and help people understand their reproductive health. So joining us now is Barbara Collura. She is the president and CEO of Resolve. That's the organization that started Infertility Awareness Week back in 1989. Also with us is Dr. Alan Copperman, director of the Division of Reproductive Endocrinology and Infertility at the Mount Sinai Medical Center in New York. Thanks for joining us, both of you. So Infertility Awareness Week, Barbara, I'm going to start with you. What do women need to be aware of?
Well, they need to be aware that infertility affects 1 in 8 couples of reproductive age, which is a very staggering statistic, and that infertility has a lot to do with the woman's age. So getting the right care quickly is very important. One of the things that we try and tell people is know the facts about infertility. For example, if you're under 35 and you've been trying to conceive for a year and it's not happening, then you need to see a specialist. However, if you're over 35 and you've been trying for 6 months, you need to see a specialist. So those are really important messages that we want women and men to know about their reproductive health. There are specialists out there. There are people that can help them. Time is of the essence, and know their reproductive health and get the care they need.
I think, you know, when you use that statistic, a lot of people are unaware because no one really talks about it, you know, until maybe after they successfully have a child. But during the process, it's a very sort of private challenge for most couples.
It is. In fact, when I tell people the stat is 1 in 8, they're shocked because they think, well, I know a lot of people and no one's told me that they have infertility. You're absolutely right. It's a silent, stigmatized condition. People don't talk about it. And that's what we try and do with Infertility Awareness Week, is bring it out in the open and give an opportunity to share this, what we think is a really important public health issue.
Right. And doctor, I presume that one of the challenges when it comes to the public awareness is that, you know, we see these celebrities that seem to be, you know, over 40, they have no problem having children. I think Halle Berry just announced she's 46 and she's pregnant. What are they dealing with that's different than the average woman's challenge?
Well, obviously, the biology is the same, whether you're famous or whether you're the average Joe or Joanne.
Right.
And I think that the difference is that we pay a little bit more attention and maybe we ask more questions when a celebrity gets pregnant. But I am sure that it's just as difficult in the 40s for somebody who's famous to get pregnant. Biology is eggs, sperm, uterus, and tubes, and we've got to get it all right to have a baby because humans just aren't that efficient at reproduction. But I think that when a couple has difficulties getting pregnant, it's important that they get the support, that they go to see a specialist, and that they know that there are these inspiring stories out there, and maybe that'll encourage them to go in and get some good medical advice.
Right, that just because the celebrity isn't talking about how they got there doesn't mean they didn't get help.
It certainly is possible that anybody and everybody gets help. Infertility doesn't discriminate against or favor certain people. It's just out there in every community that we have.
Yeah. What can a woman do to increase her chances of fertility before going to a doctor or maybe while seeing a doctor?
I think it's important to be in good health. Obviously, cigarette smoking, too much coffee, being extremely over or underweight, all can interfere with healthy reproductive life. And then timing their menstrual cycle and having intercourse at the right times are obviously going to be putting them in the position where they can achieve a pregnancy. And if they don't achieve a pregnancy, then it's important to talk to their gynecologist sooner rather than later, because there are some easy tests that we could do, and there are often some really easy solutions that'll help them have their family.
Barbara, I want to finish up with you quickly. Your organization has a scorecard, fertility scorecard, where you rank the states. You've got Massachusetts at the top, Georgia at the bottom. Tell me about how you went about with that ranking.
This is a really innovative thing. We just launched this, the fertility scorecard. You can go to resolve.org to see the map of the United States. We looked at things like access to care, access to support. We looked at the legislative climate. Massachusetts has the best insurance mandate in the country, a lot of support groups. Georgia has a legislative climate that hasn't been so friendly to our field. And so we've got the different disparities, but really it's interesting to go to resolve.org, look at that map, see how your state ranks, and work to perhaps change the grade of your state. We think that it's very empowering for people to do that.
I like it. Barbara Collura, President and CEO of Resolve, and Dr. Alan Copperman, thanks for joining us this morning.
Thank you.
Thank you.